Morning, everyone.
Good morning, everyone, and welcome to CAHN's Health Hour. Happy New Year to all of Happy New Year once again to all of you. We're hoping that 2021 is a better year, one that we all find joy and some sense of normality and some of the interesting stuff we used to do that we've been unable to do. But I think between now and then, we got to keep safe, follow the public health messaging, and making sure we're looking after ourselves and our loved ones. So welcome everyone to CAHN's Health Hour. This morning, once again, we're delighted to have Dr. Mohammed Kamara with us, one of our great supporters in CAHN. He's going to, take this section on the vaccine and some of the pros and cons. Also, just to mention that next week, there will be another session on the vaccine. And, we're delighted we bringing together our, GPs and consultants. So we might have probably 13, if not 15 of them. I'm sure I'll speak to Dr. Kamara if he's available again, but it will be a big one, and we will slightly extend that. And it will be a Q&A, for all those, doctors and consultants who have been engaging with us. They will be sharing, why they took the vaccine, why they are giving it, why they are encouraging people to give it as well. And then we hoping that we would have some, public health consultants also inputting into that. So, thanks everyone for coming. I'm going to hand over to Dr. Kamara, who will, be sharing his screen. He's going to do the presentation. Feel free to use the chat box, to ask your questions. But after his presentation, he will be taking questions from, yourselves as well. So over to you, Dr. Kamara.
Hi, good morning, everyone. And I just joined the chorus of well wishes and say a happy new year to everyone. And we're hoping that it is a happy one. So far, it's difficult to say, but we thank God for being here to see it happen. Now, this is a very hot topic, and that's why I thought it would be most appropriate to actually do something about it. By all means, as I say, I'm not here to replace, the health professionals, although I'm one of them. But it is important for our people to know about this and to see what they can make of this and to weigh the pros and the cons and decide which way forward, i.e. if they're going for the vaccine, they will do so, open-eyed, i.e. making an informed choice, as opposed to being, bamboozled or being bullied or, being, if you like, intimidated into it. But at least the details, the facts, and you can then make your mind up as to whether you want this or not. But one thing I like to underline is definitely we are the most affected people, or if you like, race, and therefore we need to act. Nobody will do that for us. We need to act, and therefore it's important for us to know these facts, and or fictions for that matter, and then decide which way forward. So I always start, as you know, with some joke, and I think this is one of them. I guarantee you that if someone was to say that, the vaccine is, in the pub and it's in the bear, well, I'm sure by next Thursday, we would have definitely got around to everyone being vaccinated. Obviously, I don't drink, so you won't catch me there. But anyway, that's what it is. So over to it. Now, it's important when we are doing anything to actually find out and define what it is we're doing. So what is a vaccine? I mean, it is a substance that helps protect against certain diseases. It contains dead or weakened versions of the microbe, that is the invasive organism, And one thing it does as well is to help your immune system, the defense of your body, to recognize and, of course, destroy this invasive microbe during a future infection. So it's a way of like someone invades your privacy, you then get, snookered once, but then you get yourself so prepared that you recognize any future invasion and therefore you're ready for it, so that when it comes, it doesn't do much, in terms of surprising you anymore. You're there on the ready to take care of it, and you tackle it better than you did the first time you were exposed to it. So in so doing, you prevent any disease, rather than try and treat the disease once you've caught it. That is very important. It's there because once it gets you, you don't know how the body would respond. But at least when you have that particular protective mechanism in you, whenever you come in contact with it, and that is inevitable, you will definitely then have something in your body to stop it going any further. So what is it? We say vaccine, what is it? You can see that the vaccine consists of the antigen, which is the thing that they put into you. It is either a killed version or a weakened version of the virus or bacteria, which trains your body to recognize and fight the disease when you encounter it in the future. And it does also have in its constituent parts adjuvants, which help to boost your immune system, and it keeps the vaccine working better. And then, of course, nothing can stay that long without being preserved. So you need a preservative in that to actually keep it active or effective. And of course, you've got something to stabilize it, during the storage and transportation, especially in the vaccines that we have, one of them being stored at -60 degrees and the other one -80 degrees. Someone's raising their hand?
Doc, will come to questions later so that we don't.
Right. So then we're on to how vaccines work. Now, if you look at it, a weak or a dead form, as we said, of the vaccine, of the antigen, of the microbe is introduced, and the next thing you have is an immune response. So you have the antigen coming in, and the body saying, yes, you're here. Let's see what we can do. Let's sort this out. So it sparks this immune response, and it develops these antibodies. So you go antigen, which is what comes in, and when it comes in, it triggers this response, and in that response, you get an antibody that is formed or made. And then this antibody will attack this antigen, and then you have the antigen-antibody complex. This is what they look for when they do the blood test to see whether you've been exposed to this, virus or bacteria or fungi, as the case may be. And then, of course, the antibodies, as you know, are the ones that fight off the germ, the invader or the antigen. And so it prevents it from coming again. Now, when it does come, even if you have it at a stage wherein it's very mild, rather than it being one that is overwhelming, because the body is now prepared for it. So this is the question: are they safe? Well, of course, they are safe. You might disagree, but I'll prove to you that they are safe, because there are things that happen to our people, and I can quite understand why there is the anxiety, where there is the hesitancy, but we've moved on, and it's been, 70 years, 60, 80 years. We'll find out as we go along why I say these are safe vaccines, because they're thoroughly tested, especially in the EU, which we've just left. As I said, all the member states would have to go through their own robust system, their own regime, which is very, very stringent, very, very, if you like, controlled and policed and monitored, and it takes years for vaccines to go through trials and tests. But once the vaccine has been used, it is also monitored for rare side effects by the Medicines Healthcare Products Regulatory Agency. So the MHRA, as you may have all heard, or maybe some of you, has just approved the Oxford vaccine, the Oxford Moderna vaccine. So that is just to show you. Now, people will say, well, why 12 months? Why not 40 years? Why not 30 years? Why not like in the case of HIV? I'll answer that question as we go along. So this is very, very important. I need you to look at this slide and tell me you do not feel the passion and you don't feel what I feel. Now, because of the vaccines, as I say, they're very safe. They are an effective way to prevent diseases and they save lives. I repeat, they save lives. You see, up to 3 million people are saved annually. Every blessed year, 3 million people are saved because of vaccines. They protect us against at least 20 different illnesses, 20 different diseases. Just think about it. If those 20 were here with us and they afflicted us, what would we be doing? Who would be going to attention? These are very important to remember. Vaccines save lives. Those 3 words, if you remember nothing at all, remember this. Vaccines save lives. I tell you what, think about measles. There has been an outbreak, especially in Manchester in the Northwest, because people were led to believe that if you do give your children the MMR vaccine, all 3 of them at one go, your child may become autistic. Your child may have problems with the bowels. And I can tell you that 2 million lives have been saved on an annual basis because we have been avoiding measles, because we have been vaccinating our children. Think about that. 2 million of our future leaders, our future doctors, our future engineers, many businessmen and all that, they all could have died. Look at what happens in Africa. Look at the big, this one. I have people who are now, like clusters, disabled, they're working, they can't work. They're actually mobilizing or walking with the crutches, sometimes, walking sticks and things like that. But that polio, because of the vaccine, got eradicated from Africa. It happened, believe it or not, that's how it is. You have 2 vaccines in 2014 and 2016 when the outbreak, when the Ebola epidemic broke out. In 2 years, we were able to develop 2 vaccines, and they have helped as well in order to protect lives and save lives. So, who can get vaccinated? Well, of course, not everybody can get vaccinated. Some people who've got chronic illnesses that affect the immune system, definitely you can't vaccinate, because if you do that, you're exposing their body to more insult, i.e., challenging the weak system already, which will then obviously knock down, the whole response and therefore threaten their lives. People with severe allergies, people with anaphylaxis, people with angioedema, the swelling of the lips, the swelling of the throat, the swelling of the face, difficulty swallowing and breathing, that would cause problems for them. Therefore, they are exempt. And then somebody who has got a recent, bout of flu and a high fever definitely would have to wait for some time, maybe I think up to like 4 weeks before they can get vaccinated. And someone has had treatment for the COVID-19 as well and had antibodies and things put in them, they can't then have the vaccine for another 90 days, So there you go. These are the types that you have. You have 4 types that we know. You have the live attenuated ones. You have the inactivated ones. You have the recombinant ones, where you have polysaccharide and conjugate vaccines. And then you have the toxoid vaccines. Now, if you look at them, look at the illnesses, like I mentioned earlier. I said 20 of them. You could see the live ones. You have measles, mumps, rubella, the MMR vaccine I talked about, rotavirus, which gives you diarrhea and vomiting, you see, diarrhea and vomiting, which can sometimes be very, very challenging. Smallpox, as you can see, chickenpox. Now, we think chickenpox is a childhood illness. Believe you me, in the adult, it's really, really a dangerous illness. It can actually kill. Yellow fever, as we know, in the African sub-Saharan region, obviously in the Amazon forest, this is very prevalent. Look at the inactivated ones. Hepatitis A, we all know about that, which is, transmitted by the hands, fecal oral route, not by the blood-borne virus, like which is the hepatitis B and C. But hepatitis A is more by fecal oral route, where the thing goes through the mouth and then it goes through the canal, the food pipe, and causes problems. Flu, as we know, influenza, polio we talked about, and of course a big one, rabies. In England, perhaps not so prevalent, but people who are coming from the sub-Saharan region do know what I'm talking about. when they are bitten by bats or dogs who are rabid, clearly they have to have vaccines against that. And you look at the, Haemophilus influenza we talked about, the type B, which is really infectious, really, really big time. It causes problems. Again, we talked about hepatitis B. And this one, the human, papillomavirus, that is the one that causes cervical cancer. Now, the young girls will bear me witness that they're all getting injections, the vaccines against that. And it's been found that it's not just the girls, also the boys, because this virus comes from them into the girls and causes a problem. So if you vaccinate the boys and vaccinate the girls, then clearly you're onto a winner. You'll minimize it. Look at whooping cough, pertussis, as we call it in medical parlance. Again, that combined vaccine does help. Of course, people who've got weak systems like cancer, TB, and all that, they know they need the pneumonia vaccine, and of course, the big one, meningitis vaccine, as well as shingles. We shouldn't forget that. Chickenpox in the youth or in the childhood will then resurface as shingles, and it can really be a challenge for our elder population. Look at tetanus we talked about. So it tells you the vast range of illnesses that vaccines can help tackle. Again, this is just highlighting the live vaccines against the attenuated or killed vaccine, i.e. the one that is weakened, and you can see the difference between them. Well, then that leads me to the question, are there any side effects from vaccines? Well, of course, like everything else, even the water that we drink has got side effects, believe it or not. Because if you drink too much of it at one go, you take 3 to 5 liters in 5 minutes, I guarantee you, it might end up really causing you major problems that it can even kill you. So that's just water, which is something that given by God, never mind medication or vaccine. So you'd expect some side effects. There'll be low grade, fever, a bit of pain, a bit of redness at the injection site. Some people have sort of reported fatigue. Some people have reported being a feeling of being drunk kind of thing, and they feel that just inactivated, not motivated for a few days, but it wears off. There's no long-lasting side effects, and if you get the rare side effects, they will definitely be monitored and they will be taken into consideration when they actually are recommending for the vaccines to be taken. So I've said a lot, but I want you to understand why we do have this hesitancy. Some of you may have seen this, but I think you need to listen to this. Just 5 minutes.
So today, America does remember the hundreds of men used in research without their knowledge and consent. We remember them and their family members. Men who were poor and African American, without resources and with few alternatives. They believed they had found hope when they were offered free medical care by the United States Public Health Service. They were betrayed.
The damage done by the Tuskegee study is much deeper than the wounds any of us may have suffered. It speaks to our faith in government and the ability of medical science to serve as a base, as a force for good. We were treated unfairly, to some extent, like guinea pigs. We were not pigs. We were all hard-working men and our boys, and citizens of the United States. the wounds rather, that were inflicted upon us cannot be undone. I'm saddened today to think of those who did not survive and whose families will forever live with the knowledge that their death and suffering was preventable.
No power on earth can give you back the lives lost, the pain suffered, the years of internal torment and anguish. What was done cannot be undone, but we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry.
Tuskegee studies occurred within many of our own lifetimes. To truly combat vaccine hesitancy and encourage diverse enrollment in clinical trials, we must first acknowledge this real history of mistreatment and exploitation of minorities by the medical community and the government. Then we need to explain and demonstrate all that has been done to address these wrongs.
All right.
So today, America does remember the hundreds of men used in research without their knowledge and consent. We remember them and their family members.
Right. Oh, well, I don't know what you thought about that, but I was moved to say, and I thought I'd share that with you. And believe me when I say this, I share your frustration. I share, anger, the difficulty of understanding, but I want you to understand that these are two different eras, these are two different times, these are two different things. This is something that was injected into people, and that was for an illness that was not contracted via the air. This is an illness that's contracted by the air, so nobody is safe. Imagine dignitaries and, if you like, non-dignitaries. This is indiscriminate. It can happen to anybody. And therefore, the hope that this is not our people, this is not us being used as guinea pigs. So that leads us to the vaccines that we're talking about. Which ones? The mRNA vaccines. They were first discovered in literature in 1990, and the clinical trials were used or were sort of initiated when we talked about Zika, the Zika virus in South America, as you know, rabies, as we know, sub-Saharan Africa, influenza, which is a global thing, and cytomegalovirus, the CMV virus, which is also very, very challenging and can cause a lot of deaths. The mRNA vaccines were first tested on human beings 7 years ago. They actually were preferred to the other traditional vaccines because of their safety. I repeat, because of their safety, the in vivo life, half-life can be regulated. That is the half-life, the time it takes for it to be decomposed or to finish off in the body, it can be regulated. And of course, you can regulate down the immunogenicity. The fact that the immune system reacts to rare in a certain way can be regulated. And of course, it's very efficacious. It's really effective, as it were. On top of all, it's easier to produce. These are just the advantages of an mRNA virus, which is a messenger nucleic acid vaccine. It's important to know this because the DNA vaccines are different, they work in different ways. I'm not talking about that because that will cause a bit of information over. But the advantage that you can see, Zika was big. It could resurface. Rabies, as you know, is big in the parts of Africa. Influenza, as we know, every year we need to be taking that. Some people do take it, some people don't, but clearly it's important to remember that. So the way the vaccines are developed and tested is, I don't even have to go into details, but I want you to understand there are 3 phases. The testing on animals to evaluate how safe it is and how good it is as a potential to prevent disease. And then you go into the phase where it's given to a small number of volunteers, I repeat, volunteers, to assess the safety. And then thereafter, once they get the results they're looking for, maybe not so good or good, if it is good, they proceed to the second phase, which is where the vaccine is given to volunteers who are closely monitored for any side effects. And once they will go through that, finding out that the side effects are ones you can tolerate, ones you can accommodate, ones you can actually expect with any other vaccines that you come across, they then proceed on to the third phase. Now, this is where in the 2000s, again, volunteers, some will receive the vaccine and some of whom will not. So you have an actual evidence-based vaccine. You have a vaccine which I don't say because I am Bill Clinton or because I am what's the person's name? Which Ransom, you know, so that I've got money and the rest of it, I've got influence and that's it. No, it's one where somebody who's receiving a vaccine thinks he's receiving a vaccine, but actually they're receiving a placebo, one that doesn't have a vaccine in it. And the other one, thinking they're having the vaccine, indeed they get the vaccine. So that way, objectively, you will get that. And that's why it's not compromised. This is what we tell you. They're safe. They are very effective against the disease. They're designed to protect against. So this is evidence of what I was talking about. If you look at this, you would see the top bit that you see phase 1, phase 2, phase 3, and then you have approval. And then you have the manufacturer, you know, and the post-marketing surveillance that you would see continue. What has happened with the COVID vaccine, if you look at the bottom one, if I can get my cursor, you can see that these are run in parallel. They're not run like that because there are a lot of red tape involved. There's a lot of ethical issues you have to resolve, and it needs a lot of funding. But because the world looked at the fact that this is really crippling the world, I tell you this for free. Just imagine, I'll give you an example just for you to understand the magnitude of what the economy is in terms of what you lose around their lives. During the Hajj season, it's just a 3-week period of the 12 months of the Arabic calendar. You have 3 to 5 million people converging to Mecca. I guarantee you, each and every one of those people won't have paid less than £2,000. So if you imagine you got 5 million people paying £2,000, that's £10 billion. Not million, 10 billion. That is what you lose in just 3 weeks. So what they decided, they had to stop, as you know. And of course, in Saudi Arabia, in the other parts of that area, they have the MERS, which is even more lethal than COVID-19. So you can see why the world had to move. Otherwise, this would just wipe out everybody, as you know. Therefore, they had to take all the red tape and they had to pump money into it. Hundreds of millions of pounds were pumped into making sure that we get this vaccine within 12 to 24 months. So that's how they achieved it. People do, because the question people are asking, but for 40 years we didn't have vaccine for HIV. Well, HIV was a disease that nobody talked about. It was assigned to one particular group, and that's it. Nobody else, had to think about it. It was something you can't talk about. People live their lives and then end up, infecting one another, the family. I don't even want to go into the details of that. But it turned out that's a different thing altogether. So the bureaucracy, the red tape, and of course the lack of funds is what would delay the search for vaccines. Whereas this time, they decided we'll wipe off all of that, take off all the red tape, and pump money into this and get this thing out, because otherwise we stand to be extinct as a world as we know it. So I hope you understand that. Again, this just gives you a graphic, if you like, display of what has been happening. Look at polio, we talked about. 60 years it took because of all that red tape. Look at Ebola, as I said. 2 of them we have already between 2014 and 2019. It's 2 of them. Yeah, it took 15 years because it has been on since 1976. It was found by Professor Peter Pyer, who was just newly graduated, a microbiologist. But look at it, 15 years before it took us to get to these 2 vaccines. The SARS virus, the first one, took 17 years because, again, of the red tape and the lack of funding. The MERS, which, as I said earlier on, is non-lethal, 6 years. But look at the COVID-19, 12 months. Now, I said a lot of money. The Pfizer, it was over £40 million that was put into it to get it out, because it is important that otherwise we're doomed. So there you go. This again just gives you an answer. But I want you to pay attention to this particular slide, because people have been asking me about how this thing works. Each and every one of those vaccines would give you immunity, but you have to remember all the 4 vaccines do have 2 injections. This is 2 injections. I have 4 of them. In fact, there's a 5th one, which you don't know about. I think the Chinese have also researched and developed a 5th one. But the ones we know that we actually agree with are the ones from Oxford. The one, which is American-based, the Pfizer biotech, which is German, and of course the Sputnik one, which is Russian. As you can see, there's 4 of them. But I'll go back on this slide. They all do need 2 injections. So when you decide you want to take the injection, remember that you're likely to be protected, not from catching the disease. I repeat, not from catching it. You still can catch the disease. What it prevents you from doing is contracting the most severe, I repeat, the most severe, or the severest form of the infection is what you're protected against. So if you see people on incubators, people with ventilators and all that, people who are actually put to sleep, they definitely have got the severest form of the disease, and that is what the vaccine will stop. How long it protects you from having it or from contracting it, how long it actually protects you from having a recurrence, I can't tell you, because it's just been a year. Now, bear in mind that even though you may be vaccinated, you still can transmit the disease. Remember this. So therefore, you still have to self-isolate through the contact tracing system. That is important. You still have to maintain the masks, the distancing, the social distancing, and of course, the routine washing of hands and the rest of it. You have to continue to do that. So you get the first dose, which is given in the muscle on day 1. And believe it or not, there's nothing that happens then. You get then to develop or start to develop immunity on day 12. And between day 12 and day 21, it begins to rise. By the time you get to the second dose, when you take it, you get this meteoric rise by day 28, when you know you'd have developed up to 90-95%, protection against, again, the severest form of it. So between day 1 and day 12, there's nothing you have. So if you think, it's just a natural reaction. You think you have taken the vaccine, I've taken the first shot, therefore I am immune, or I must, lower my guard. Please, please, please remember, you have nothing there to protect you. Therefore, you still have to continue to maintain those preventative measures, those protective measures. And when you start to build up the immunity might not be high enough or strong enough to protect you against, catching this illness. Until you get to day 21, when you get the second dose, and the second dose will then trigger this, meteoric rise, this roof, like, you going from gear 2 to gear 4, if you like, if that's allowed, when you're driving. And then you get to day 28, when then you definitely would have got what you wanted. So we go down to this again. Can you see that there's 4 of them, as I said? They give you the type and they give you the doses. They all 4 of them do have 2 doses. But look at the logistics of how to store them. If you look at the Oxford one, we like that. But the trade-off is the fact that it may not be as effective as the other ones, because all the other 3, i.e. the Moderna one, the Pfizer, and the Gamaleya, they're all above 90 degrees efficacious. The efficacy is 90%, sorry. And so, but this Oxford one is between 60 to 90. Now, the advantage it has over the other ones is that you can actually store it in the fridge. You know, you can take it, the GPs or the other people, the nurses or whoever is taking care of this vaccination can go about to people's houses and do it. So logically or logistically, it's a lot less burdensome and a lot less taxing compared to the other ones, especially the Pfizer that you have to store in about minus 70 degrees and maybe minus 90. Although it's a thing, but then you have to thaw it out. And when you thaw it out, you know, it takes like 5 hours. And after that, you need to be using it. And the batch itself needs to be disposed of within 5 days. So you look at the logistics and you think, well, which one do you have to take, or which one is it that is more beneficial in terms of how you can actually target and access the population in general at large. And I must tell you as well that you can't interchange these two. It is not efficacious at all. So if you have one vaccine available and that's what you have taken the first dose of or the first injection of, you can't then change it to the second one. And this is where the confusion arises, whereby with the Pfizer vaccine, the manufacturer, I repeat, the manufacturer recommends 3 weeks interval, just like I showed you there, 3 weeks interval, so 21 days. But of course, now we're facing a situation where you can't get that done within 21 days. Therefore, they're actually suggesting that you probably take the first one and then you would have to take the second one within 12 weeks. Now, I don't know what your feelings are, but clearly it is not recommended. The manufacturer recommends 3 weeks. So, but the Oxford one, which is actually the one we were waiting for, that could be stored in regular temperatures and all that, that one you can have the 12-week interval. And it's really effective in terms of capturing the immunity that you require between the first dose and the second dose. Whereas the other 3, they recommend 3 weeks. I hope I'm clear in this. So what type of immunity do we expect to achieve through vaccination? Well, protection from the illness, impossible. Protection from the disease, that's absolutely, we will guarantee that you will get some protection, definitely, especially the severest form of the disease, but it doesn't stop you transmitting it. And the most important thing is nobody can tell you how long the immunity would last. But you can say, judging from the examples of other similar illnesses and similar vaccines that have been used in the past, you have 6 months to a year. And that's why you can see every year, annually, we have the flu vaccine coming up, and obviously meningitis vaccine and the pneumonia vaccine for people who need it. But look at that, the 2-dose regime, this is why it is important. 2-dose regime that everybody needs. Globally, it's about 16 billion doses that would be required to fit in the population of 8 billion. Just imagine that 8 billion of us are on this earth and 16 billion is what you need. However, for you to immunize 75% of the population, by which I mean you would be able to achieve the herd immunity status, you require 13 billion doses. Just think about that, 13 billion. Definitely it's a tall order to think that any government, with all the combined energy and forces or economies and all that, will be able to provide these 13 billion doses within a short space of time. It's just not possible. So therefore, think about it when you're asked to go for it. You either go for the one that has the 3-week interval, which I know they're now extended to 12, but then the manufacturer tells you 3 weeks is what we support, because there's no guarantees that the immunity would be up to that level by the time it gets to 12 weeks. or the Oxford one, the Moderna one, which the manufacturer recommends 12 weeks. So there you go. I mentioned herd immunity, and that's it. This just tells you, if you look at it, when you have just a few people vaccinated, one person gets infected, the disease spreads like, wildfire. Whereas on the opposite side, when you have a lot of people vaccinated, look at what happens. The disease cannot spread very far because the whole community can then be safe. And of course, you have to achieve 70% of immunity for you to say that diseases cannot spread as far as that. Remember, when someone sneezes, it's like 10 feet distance. That's how that can go. So you sneeze and cough, a really powerful cough, explosive cough or a sneeze, it's like 10 feet away it would go, and it takes a lot longer to get to the floor or the ground. So it just shows you the potential. So this is all what we talked about, the vaccines, the claims that are factual and the ones that are true or false. The vaccines, obviously, we are told the Bill Gates microchips, and they have trackers that they put in our people. That's false. That's a big, big false. And of course, it is relevant to these vaccines we're talking about, the Pfizer one, the Moderna one, and of course, the AstraZeneca one. The vaccines are made up from cells of aborted fetuses. That is true for some, false for some, but yeah, it relates to this particular vaccines we're talking about. Indeed, that's true. The vaccines contain objectionable substances such as pork. Now, that's true for some of them, but this particular vaccines we're talking about, that is not so. So Muslims should not be worried about it being not halal. It is definitely a product that does not originate or does not have any pork or gelatin in it. They are genetically modified substances. Yes, they do have them. And in this particular vaccines we're talking about, yes, there is modification of the virus in order for it to be effective. Again, it's good for vegetarians, and it's definitely acceptable for Muslims and maybe Jewish or the ones that are vegans or vegetarians. Yeah. You must know this, that the vaccine companies are getting indemnity from the government. So any of those volunteers definitely do have indemnity. So if anything happens that is adverse, really severe, they have indemnity on that. And that's why it's voluntary. Nobody's going to force you. Nobody's going to make it mandatory. Even for me as a doctor in the front line, it is not mandatory that I take the vaccine, but it's, encouraging and reassuring. And we definitely are, sort of urged to take it because of our own safety, because of our own vulnerability, and because of our ethnicity. We need to be in the forefront. So they are rushed through these vaccines, as you all are claiming. Well, yeah, they are, but the fact is they had to be done because otherwise we could not survive this. And this was only achieved by the amount of money that was put into it and by removing all the bureaucracy that was actually, something that we faced in the past when we had trials and things like that. Okay. So that's how this thing works. I want you to understand that the messenger RNA virus within the cells lives for like 4 to 5 days, and then thereafter gets destroyed through the clearing system that we have in the body, in the cells. It only remains in the cytoplasm. I want you to understand that it doesn't affect the nucleus. There is no chance of it going into our DNA. So there's no chance of the DNA being destroyed or DNA being altered. That is a lie, that is a non-truth, and that is a fallacy. It is not. The RNA cannot be reverse transcribed into a DNA. I repeat, it is not possible for that to happen because it's an mRNA vaccine. So last but by no means least, we talked about the COVID-19 virus, but I'm sure people are dying to ask me about this new strain. Well, there you have it. This is hot off the press. The new strain, and of course the third strain that we're talking about, the South African variant, they say, it's not something of a new phenomenon when you're dealing with RNA viruses. The RNA viruses, as I say, I told you, there's 4 classes of these viruses that the COVID-19 virus belongs to. They've got the 4 classes, alpha, beta, gamma, and delta. We've been dealing with the alpha one for years, the flu virus. Definitely, it mutates. I remember there was one year when everybody or most people got vaccinated against the flu. Everybody took their flu shots, and it turned out that the vaccine itself did not actually include that particular mutated strain, and a lot of people suffered with that because people who took the vaccine thought they were protected, but then they ended up, contracting the mutated strain, and so a lot of people died, and that is what happens. It's a natural, very clever characteristic of the RNA virus. That is why you see the HIV virus, which is another example of the RNA virus, is so difficult to treat. So they mutate, they change. And when they change, you have to then try and change the vaccine. This is why it's difficult to actually track them down. So the new strain that we do have is up to 70% more transmissible. It spreads quickly. As you may have heard, there is a major incident in London, the capital. It just tells you. A major incident is declared when the emergency you face, the burden of the problem you face is not something you can deal with as a city, as a trust, and then you declare a state of emergency, so to speak. So a major incident is one whereby the demand is unequal or not, it doesn't tie in with the supply. So the supply is mismatched with the demand. So the demand is more, the supply is unavailable or less so. And therefore, it becomes a problem. Yeah. So what it means for us is that the normal COVID-19, if it affects, say, 10,000 people, after 1 month of spread, 129 cases from the new, 129 deaths would have occurred from the new cases. Yeah, that's the normal one. With the new one, a 50% is, more effective in terms of transmissibility, then after 1 month, you could see 978. So you're looking at almost 10 times more. And therefore, we must not let our guard down. We need to stay home. We need to wear our masks. We need to observe the social distancing, and we need to be washing our hands as we should. Now, I've got a few more things, but I don't want to go through them because I realize I've been talking for like, 40, 50 minutes. If you want to, we can go through them, but let's stop here so far and take it from there. This is my last slide, but not unless you want to continue. I have the myths and the answers, but that would come maybe later. But for now, I need you to take these home. This message is home. These are take-home messages. I need you to think about it. The loss of life, the suffering is huge. I don't have to overemphasize it. You see it yourselves. I've seen loved ones, I've seen colleagues, I've seen friends lose their lives, develop long COVID because of this. People have paid the ultimate price because of this. So the loss of life is huge. The suffering is huge. Believe you me, 1.6 billion students in the world are out of school. This is our future that is at stake. Think about that. On the plus side, the human trafficking is far less because of this. 1.6 billion students who are at home. The human trafficking is less, but that is for me far less important than what we're going to be losing in the next 25 years, the next generation. The rise of poverty through the loss of jobs, the businesses that are folding, the enterprises that are going bust, going under, is unimaginable, immeasurable. The mental health effects, the domestic abuse has just through the roof. The effects on our livelihoods, we can't expect to live life like we lived it pre-COVID. From now on, you got to remember, there would be the world as we know it pre-COVID and post-COVID. But remember one thing, if nothing at all, remember that the vaccine provides you with some hope of a return to normalcy, at least post-COVID. Otherwise, we're all doomed. Thank you so much for listening to me.
Thank you very much, Dr. Kamara. And, if you could send over the slides, we will, share that. And, lots of questions in the chat box, conscious that some of our viewers didn't join from the beginning. So, if you can stop sharing your screen so that we can see you fully, and then we will try and take, some questions. I think the first, I know you touched on that, but people seem to be concerned about the pace at which this has been developed. I know you've talked about removing red tape, investing hundreds of millions of pounds into this, but I wonder what you could say more to reassure people about the pace at which, this has been produced, because some are still saying we don't have vaccination for HIV, but we do for COVID-19.
Well, I mean, I think the answer is there for you all to see. I keep saying, people are a lot more aware nowadays. People are a lot more, if you like, sensitized to all the wrongs that had happened in the past. The control system, the policing system is a lot more stringent, a lot more transparent, a lot more, if you like, meticulous. So there's no hiding this. Now, if people want to believe, I mean, I can't make people believe what they don't want to believe. All I can tell you is that imagine you have got 10 workers doing 5 hours a day, and you've got 100 workers doing 2 hours a day for you to actually be able to go through a piece of land that is 10 by 10. Now, the 5 workers or the 10 workers would have probably achieved that in a certain period of time. These 10 workers, you could actually say they work 5 hours a day. But if you were to double that by, dangling the carrot, incentivizing them, I guarantee you they'll finish that piece of land exactly the same time or maybe sooner than the ones that are like 10 times more, i.e. 100 people. I don't know if I'm making any sense. So wherever you have money, as they say, money talks and things happen. So just the Pfizer alone, there was 45 million pounds. That tells you why it is important. I told you that for the Hajj season, which is just 3 weeks in the calendar, Islamic calendar, 10 billion pounds was lost. So you speculate to accumulate. That's the business logo. That's the business jargon. It's something that is known to happen. Yeah. And of course, the red tape. We just talked about it. If you remove the red tape, something that could have been achieved in 10 years would be achieved in a year. There's no hiding it. It's as simple as that. If you want to do something and you were told you have to go through Mr. A, B, C, D for you to get to Mr. Z, clearly you know when you remove the middleman, it's a different thing altogether. You achieve Z in a lot quicker time than if you were to go through the whole of the alphabet. I don't know if I'm making any sense. So think about it. You have the choice to decide, well, I tell you what, all right, okay, HIV has not got a vaccine and this and that. Fine, go for it. But you watch the number of people that are dying and see what's happening. I keep telling you, I can't make that decision for you. I can only tell you what I know, that things are a lot different. Now, I told you about the Ebola virus. Yeah? 2 years it took because the world knew what was going to happen. The Western world did not do anything when there was this outbreak in West Africa until they realized that, hang on, there are people that are connected to the Western world, the likes of us who've come from there, people from Liberia into America, people from Guinea into France. Yeah, this disease then became exported or imported to them, if you like. And in the end, they realized, hey, hang on, we need to do something. So again, the red tape was removed, and within 2 years, they actually got 2 vaccines. So it is doable. I don't know if that is reassuring enough for you, but it is doable, and there's no hidden agenda.
Thanks, Doc. I think the other point that has been made in the chat box, a number of people think that by the government waiving of indemnity for the manufacturers, then it means that legal recourse, if there are long-term side effects, have been removed. I don't think that's the case, but I wonder if you could comment on that.
Well, I mean, I'm not a lawyer. I'm not a corporate lawyer, nor an industrial lawyer. All I can tell you is when people go into this thing, you see, people don't understand how, I don't know if anyone has actually participated or maybe being a member of any group that was researching or trialing something. You have to go through certain things. You have to get, there is a certain checklist that you have to go through in terms of your health. So clearly, just as I tell you, before you were given the vaccine, if you decide to take it, they will ask you certain questions. They will ask you, have you had flu-like symptoms within 4 weeks? If you say yes, there's no chance they're going to give you that. Because they know if they give it to you, clearly they'll be breaching the law, they'll be breaking the law, and they are liable. They will ask you, are you allergic to eggs or something, for example? If you're taking the flu vaccine, they'll ask you, are you allergic to eggs? You say yes, they will tell you, we can't do that. You'll have to think twice to do it. So there are times when, as I know, in the past, when you looked at the cigarette packet, there was nothing there written that cigarette can cause cancer. Nowadays, you pick up the cigarette pack and you see what's written on it. So nobody wants to be liable because hundreds of millions of dollars or pounds or whatever would be paid in indemnity. If they indemnify the manufacturers, well, there has to be a reason for that. But what I know is that this is not mandatory. This is voluntary for people to go into it. And if they indemnify them, perhaps it's in view of the fact that nobody knows what the long-term, side effects would be. And nobody is able to tell you that because this thing is just a year and a bit old. But like everything else, you have side effects, they're there. The only thing I can tell you is that I know for certain that, in fact, it's recorded. Now, somebody said something about, for example, they developed facial nerve palsy, the 7th nerve palsy, like this Bell's palsy, they developed it after the vaccine. Indeed, this has been found. I don't know if you're aware of it. There are 4 cases of that, yeah? But it could just well have been a coincidence. We don't know that. 2, every virus has the potential to affect any kind of nerve. So if by some bad luck or ill fate, it actually affects the 7th nerve of the face, you can't just say directly this is linked to the vaccine that you have. It's easy pickings to sitting doctor say, yes, this is a causal effect. I do this now and 3 days later, that's what happened. Well, I tell you what, I can tell you that if I knew what was going to happen in 10 years, I would have planned my future. But nobody can tell you that. This thing is just a year old, so you have to take a leap of faith and believe that, look, in the past, polio, smallpox, measles, all of these have been actually tackled well, yeah, with this approach. So there's no different to what we're doing. It's no different to what we're doing now. We just want people to understand that it is important to remember that vaccines do save lives. Obviously, in everything you do, there's a downside and there's an upside. But for me, the upside is far, far outweighing the downside as we speak now.
So, Doc, someone is asking if you could clarify what you meant by herd immunity. And also someone is asked whether, as a medical professional, do you not have any concerns about the vaccines?
Well, herd immunity, I think I explained, as I say, herd immunity is where you have 70% or higher of the population being immune to the kind of illness that we're tackling, and for you to achieve that, you have to have a potent vaccine. And tell you that without that, there's no chance because of the particular illness we're dealing with. If it was if you look at the video that I sent, that I actually showed you, it's 400 people, and these were limited. And it took 30, 40 years for that to spread to the families and those who are affected. This is a different kind of beast. What we're dealing with is an airborne thing. It's something that's spread in the air. Therefore, as long as me and you have got life in us, have got breath in us, we're breathing. So therefore, it spreads faster. Especially in this particular case, it's far more enhanced because it's an RNA virus. Now, the RNA virus has got this specific clever characteristic where it changes itself. So catching up with it, it's a bit like the internet thieves, they're always one step ahead of you. So you need them to actually be changing your cards, the pins to your cards every maybe 2-3 years. That's what the banks are doing, because otherwise they can't catch up. And that's exactly what the mRNA virus, the RNA virus is doing. It mutates. This is why, as I say, up till now, we have this flu vaccine problem, because every year we have to be doing, because the strains change and you've got to keep up with them. Otherwise you contract one, and if God forbid your immune system is not as good as it was 5 years ago, 10 years ago, you might end up, you know, paying for it. So you don't want that to happen. That's why you need to protect yourself. Now, I am concerned, I think the second part of the question, I am concerned because of the fact that there's a lack of availability of these vaccines. People want to take the vaccine, but they're not available. And that worries me. Because of the fact that without the vaccine, you cannot achieve herd immunity in a short space of time. And this disease is not waiting for anybody. It is spreading like wildfire. As I say, as I speak, in London, there is a major incident. I talked about it. Major incident, which means the demand far outweighs the supply. And they are actually using theaters that we used to operate on people and now doubling up as wards, as COVID wards. That just goes to show you the rapidity of it. You can actually allow that to happen. In Africa, it's prevalent, whereby the disease happens, people survive, the ones that can survive or that do survive, and the ones that will perish away do perish, but then they survive because they have this thing. But that's the kind of illness that is not spread by wildfire, like it is. What we have here is something you cannot control, and therefore you need to act fast enough to actually catch up with it. Like I said, if you have the pins of your cards changing every day, you need to be changing it every hour in order for you to be able to catch up with these thieves. Other than that, you will definitely lose all your savings. I don't know if I'm making this analogy right enough for you to understand it. You need to get on top of it. And for you to get on top of it, you need to be quicker. That means you have to have this friend of yours, this ally, who is the vaccine. Without the vaccine, you cannot achieve the herd immunity, which is 70% of the population in a short space of time. That's what the vaccine does. It gives you the immunity in a short space of time, which you can't naturally achieve because it takes a bit longer. And by then you'd have lost a lot of lives, and you don't want that. At least I hope so.
Doc, thanks for that. You know, lots of, you know, chats, you know, lots of conversations and discussions happening in the chat box, which is great. And just to inform yourselves, next week, Saturday as well, we will continue with the subject of the vaccine. If Dr. Kamara is available, he'll be joining. But we're going to have a panel of about, you know, 14, 15 GPs, consultants, all from our Black community who have taken the vaccine. I think shortly it will, you know, a flyer will go in the chat box and you see some of the doctors themselves. So, you know, as CAHN and as an organization, we will do stuff based on the evidence. We will bring you people who believe in what they're doing, not people who say to you, don't do this, and then they will do something else. So please, you know, share the flyer, you know, circulate the Eventbrite list. You know, the link has gone in there, or you can use the same, you know, meeting ID. But I think it's great to have all these doctors and consultants coming to say, I've taken the vaccine. You can see from the flyer, some of them, you know, they've all taken photos receiving the vaccine. They will be given that, and that's to help rebuild confidence. Doctor, there's another question here asking, you know, that there is fear out there from people with underlying health conditions, you know, such as heart failure. You know, how can you build confidence, you know, and encourage such people to consider the vaccine when they offer it?
Well, heart failure is not a contraindication to the vaccine. That's the short answer. What is a contraindication to the vaccine is actually severe anaphylaxis, which is one where somebody takes an injection, like penicillin injection, it goes into the vein, and the next thing you realize, oops, they can't breathe. The tongue swells, you know, the face swells, and then of course the breathing pipe, the windpipe becomes closed, and that is a nightmare of a scenario. That is when you would say you wouldn't give that. So that's where they would ask you, do you have an EpiPen? They would ask you that question. If you say no, are you allergic to anything? They would ask you, do you have anything like angioedema that would have happened? But heart failure is not a contraindication to the vaccine. If anything, it is these people, the ones with heart failure, who are very prone to developing complications, catching infections. And as I say, because the chest, the lungs, are the organs that actually communicate with the outside world on a regular basis, far more than any other organ that we have in our body. Therefore, the chest is where a lot of problems happen. Most of the people who have got, you know, chronic diseases, like for example, cancer, you know, God forbid, most of them probably sometimes it's not even the cancer that kills them. It's the fact that the immune system is so weak that the lungs contract superimposed, we call them superimposed infection. We talk about HIV, the immune system is completely in the boots. Therefore, the friends that we have, the microbes that we have, which are friends that we live together and don't know anything about, when we have a normal, we call it immunocompetent system, now become rogues. They now become our enemies. So they then create these superimposed infections, and therefore we fall victim. So somebody like that who falls into a high risk category, I would encourage to go and have the vaccine, because that would protect you. And this is why the elderly, you know, group, the group in the elderly are the ones that are with possibly comorbidities, i.e. they would have had things like the hypertension, diabetes, you know, chronic illnesses, COPD, heart attacks, valves replacement, you know, strokes and all that. Those who are in that higher category definitely need to be considering to actually put themselves first. And this is the only time I would ask you to be selfish. You know, put yourself number one, look after number one. You need to get those vaccines. If you can, please, please, please do that, because it will protect you. Doesn't mean because you have heart failure, you're not, you know, supposed to be taking the vaccine. If you have any anaphylactic history and edema and all that, then clearly you can't. But then you then need to be more vigilant. You need now to be protecting yourself a lot more than somebody who has had the vaccine.
Great, thanks, Doc. I'm going to bring in Elizabeth, who's raised her hand. So please, I know there's been lots of, you know, questions and discussions in the chat box. If you have any question, use the raise hand feature, and then I will bring you in. And, you know, Elizabeth, if you can, Elizabeth Gard.
No, I'm sorry. Yeah, that was a mistake.
Okay.
And all my questions have been answered. Thank you so much, Charles.
Great, great. So Dr. Kamara, Natasha has just asked a question. Would you encourage men and women of childbearing age to take the vaccine, considering there's no evidence of how the vaccine will affect fertility? Next week, we're going to have some gynecologists on the call, but what would you have to say about this?
Well, as I say, I'm not a gynecologist, and I don't think any gynecologist will tell you that the vaccine will affect fertility. I can bet my last pound on that. The reason why I say that is that the vaccine has got no way of getting into the testicles, if you like, or going to the ovaries or going to the fallopian tubes. There's no chance of that. This is an mRNA vaccine. And if because it's an RNA vaccine, it will be in the cytoplasm, not in the nucleus. The DNA is embedded in the nucleus, therefore, it can't affect it. If anybody encounters that, probably they need to look further afield, i.e. look for other things that may have caused that. It's easy to point fingers to say, well, this is that, that is that. But if you don't have that evidence, and as I say, nobody can actually envisage what would happen in 10 years. So I can't sit here and tell you that the side effects of the COVID-19 vaccine are such that they wouldn't cause you left, right, and center. But fertility is a bigger problem. That's something that just has to be sort of narrowed down to a vaccine. I don't think that's the case. We need to probably be open-minded and be frank with ourselves. If someone is going through fertility problems, probably they need to be investigated a bit more than just say, well, hang on. The COVID vaccine is what caused that. I don't think there's any evidence of that. Besides, the vaccine is less than, well, it's like a year and a half or year old. And nobody can tell you what's going to happen. If you tell me that the human papilloma virus vaccine, which we give to our youth, now we're giving it to the boys. We used to give it to the girls, now we're giving it to the boys, because we found out that the virus, the human HPV virus, is one that has been found to be the culprit of cervical cancer. And I'm sure you'd all understand that they give it to the kids to prevent this happening. Only you can't tell me that because of fertility issues that we're not aware of, we're not sure about, this vaccine is going to cause that in the long term. I don't think that's the case. We actually have looked at things in the past. We have vaccines, as I say, look at the polio vaccine. We don't know anything about that. Look at the smallpox and all that. All of these did not stop the world population ballooning or mushrooming into 8 billion. So think about it. If someone just tells you that, I mean, you've got a head on your shoulders, think about it. Why would you think that it would affect fertility? I don't quite understand that. The same thing you can tell me, it is satanic. Well, I mean, I don't subscribe to that, I'm sorry. But the fact of the matter is, there's nobody that can tell you that in the long run, this is going to affect fertility, because this is a year old, but you are here now and you need to probably look after number one, i.e., if at all you have to have children, you will get the children. I don't think a vaccine will stop you having children. But if you don't take the HPV vaccine, you could end up with cervical cancer. And if you do end up with that, well, they would have to freeze your eggs and things like that. And maybe at a later date, when unfortunately you'll be gone, then somebody else can have your children, or your eggs could be used to reproduce. But I don't think anyone in their wisdom can tell you that this would affect fertility in the long term. That is my take on that.
Thanks, Doc. There's a question about changing directive about the lag between the first and the second dose. You know, so previously it was meant to be 3 weeks. You know, that's been changed, and people are concerned about that. And also, someone is asking why children are not allowed to have the vaccine. After which I'll bring in Teresa.
Well, I mean, I think I alluded to that. I think I said that is my concern, because of the fact that the manufacturers themselves recommended a 3-week lag, if you like, or a 3-week interval for the Pfizer vaccine. But of course, I don't want to be dragged into politics. Now, because of the possible mismatch in the demand and supply, because as I said, 16 billion is what you need for the world in you know, the 8 billion population. If 2 per person is 16 billion. Now, that's a tall order. Doesn't matter how much money the world has, I tell you that, especially in this particular circumstances where you're losing, you know, the world economy. It's actually on its knees. And then clearly it's going to be, and people, as I said, the government in America, it tells you we've provided 17 million vaccines. So far, they've only received 4 million. No, not even America. Here in the UK, 17 million, they say. So far, 4 million is available. Where is the 13 million? And GPs are longing, asking for these things to be delivered. They're not delivered. So because of the lack of these vaccines, they decided that, well, I tell you what, it's better off to have 1 dose, so that by the time the second dose is available in the, you know, maybe March, April, we might be able to then talk about the second dose. But as I say, the manufacturer recommends a 3-week interval. The only manufacturer that recommends the 12-week interval is the Oxford manufacturer. And that is what some people are waiting for. And the other thing is, you can't interchange it. If you have started with the Pfizer one, you can't then move over to the Oxford one or the Moderna one. It won't work. It's not efficacious at all. So you either decide you go for the one that has the 3-week lag, or the one that has the 12-week, wherein you have the immunity that will be high enough to protect you, than just go for the 3-week one, which you don't have available.
Thanks, Doc. I'm going to bring in, Doc, did you touch on why children are not being allowed to take the vaccine?
Well, I mean, as I say, I don't think there's any evidence. For one, the children we found are not as badly affected as the adults. In the previous, I think, talks that I've done, I think I did one on COVID in children, as far as we know. The most dangerous aspect of the children is the PIMS, you know, where we have this Kawasaki syndrome, which was one that would cause, you know, the aneurysms in the blood vessels, and of course the kidneys and things, and organ failure and the rest of it. So most of the children might be, you know, if you like, transmitting it, but most of them do not get affected as the adults. I don't think they've actually looked at the children themselves in terms of the possibility or the need for vaccination as it is with adults. Remember, you're talking about indemnifying. There's no chance they would want to use children as the testers or the guinea pigs, so to speak, you know, in trialing this. So I don't think the children have been included in this, and therefore it's a bit difficult to say. But of course, the other vaccines we know that are geared, you know, towards the childhood diseases definitely would have looked at that. But that's what you have. You know, the children definitely, they're less so, if you like, impacted upon compared to the adults, and therefore it's a difficult one for any manufacturer to say, well, I'll trial a child. I think you'd get some uproar if that was to happen.
Thanks, Doc. Please, if you have any further questions, you know, put them in the chat box or use the raise hand feature. And between now and next week, when we have the plenary, you know, just the doctors answering, taking your questions, you know, we will make sure that those are asked as well. So I'll bring in Teresa. Also, our viewers on YouTube, we've got over 10 people on there. If you have any questions, post it in the chat box. Over to you, Teresa.
Thank you. Hello, Dr. Kamara.
Yeah.
Hi. My question is, if you have people who have immune suppressants, so they're on medications such as methotrexate and other things on a high dose, how would the vaccine affect them? I mean, if their immune system is already very low, how would the vaccine affect them?
Yeah, I think I mentioned that in my presentation. Obviously, people who've got, you know, compromised immune systems clearly need to be taken into consideration in terms of fitness, or maybe being the ones that could actually take it. I think it is a balance of probabilities. The GPs will be better placed to actually know your history and know how well you are you're placed in terms of what you stand to gain and what you stand to lose. But immune compromise clearly would be not necessarily an absolute contraindication, but it would be a contraindication, maybe partial or kind of a contraindication to actually having the vaccine. So therefore, it is important to channel these you know, uncertainties via the GPs or people who are actually offering, because as you go there, they're not just going to give you that. They will ask you questions, and these questions will pertain to your life, you know, and what it is, medication you're taking, your allergies to anything, and there's a checklist, there's a tick box which you have to go through. So if you get to the part where they say you've got immunocompromised, where you're taking methotrexate because of a problem that you have or illnesses that you have, clearly it puts you on the risk, on a category which is very risky in terms of being one that would take the vaccine or not take the vaccine. So I'd say before you take it, make sure that you ask the question and clarify whether this is for you or not for you, and if it's not for you, what can be done about it. But clearly, immunocompromise is one contraindication for the vaccine.
Okay, so would the choice still be yours? I mean, if they say like, well, your immune system and everything, you know, we wouldn't recommend it. I mean, would you still be able to say yes, but I'd rather have it than not have it?
Well, if they recommend that you don't take it, obviously they would say we have recommended you don't take it. Now, if you decide you want to go and take it, then this is where the indemnity comes in. Really, it is your choice. Same as they're asking people to take it, and you're saying I don't want to take it. Now, for example, I haven't taken it. The reason why I haven't taken it is because of the fact that I wanted the one that would actually be efficacious between day one and the 12-week interval. I know it on good authority that they told me, when I asked about it, they told me that from the first injection or the vaccine that you have to take today, you would have up to 90% protection. And I said, well, okay, if I have 90%, why do I need any second one? And then they told me this is a question I can't answer. I said, well, the manufacturer recommends 3 weeks lag period, and you were saying you can't. up to 12 weeks. Well, you say, well, you have to channel your question to NHS England. I say, well, I don't have that. I don't have the luxury of that, because once I've taken the first one, you're now looking at me not being protected. And I don't know, as far as I know from the research that we have, the immune protection is quite low from day one. So by the time you get to day 12, you might probably develop a bit, which is understandable. But then you need the second one to actually get that meteoric rise. Whereas with the Moderna, it's a different thing altogether. The 12-week gap, clearly, you could actually get the immune protection that you need at a reliable level to protect you. So I'm waiting for that to come through so that I can take that. Now, I don't know if that helps you, but you as an individual, it is not mandatory that you take it. It is something you'd have to take. But if you as a person is unwell, i.e. you've got extenuating circumstances, mitigating factors, the GP or whoever is administering that would say, well, I tell you what, based on what you have, the risk assessment that we've done, we think you should not be taking this. If you then decide you want to do that, you want to take it, then obviously it will be your own decision against medical advice. That is what will be documented.
Oh, thank you. That's great. Thank you.
All right.
Thanks, Doc. We've had, a couple of questions and then we will run up. I mean, one is, considering we have 3 different types at the moment, obviously the one from Russia is not in the UK. Who decides who gets what? What goes into that decision making? And then we've had about 3 or so questions about allergies. So are there any alternatives for those who have allergies and will not be able to take the vaccine, or for those who react to penicillin? What are the alternatives for those who don't? For those who have allergies.
Well, I mean, as I say, it's a bit like wearing the mask. It might not be the same thing, but the analogy is just that, people who've got this anxiety, people who've got this asthma, people who've got COPD, who can't breathe behind the mask, clearly you have to look at the alternatives. Maybe avoid the crowds. That's one thing, yeah. And obviously, if you can afford to, maybe get a car, where you can be on your own, or maybe 2 people. These are all alternatives. But one thing I know is that if you've got this really severe allergy, then it's more incumbent upon you to look after yourself, like you have been doing prior to the vaccine. Remember, the vaccine just came out, maybe a month or 2 ago? Before then, we've been tackling this beast for 12 months, remember? And we've been coping by doing what we do. The last thing on my slides, I don't know if I can go back through it, is like I said, I think I remember saying that you need to still continue to protect yourselves. It's as simple as that. And the way you protect yourself is by the social distancing, the washing of the hands, the wearing of the masks. So if you have the allergy and you are not eligible, or you can't take the vaccine, then clearly you have to protect yourself like you were doing before the vaccine came to be found or discovered or cleared for use. That is as simple as that. You revert to type. So if, for example, we're all using computers and all that in the hospitals. When they crash, what do? We revert to type. We go back to using the papers, which we used to work with, and it worked effectively. So as an alternative, that the measures that were prescribed for everybody without exception are such that social distancing, the mask, yeah, and of course, avoiding the crowds, and most important, personal hygiene, washing of those hands as frequently as you should. That's the only way you can actually combat that. So you avoid that until you can get to the level where you have that herd immunity, so that those who would have had the vaccine would be up to 70%. And then, of course, you then would be a safer person to go out and do things like you used to do, but without the mask or without the social distancing. I don't know if I'm making any sense, because you need to understand that the vaccine is just there to prop up, to help you achieve that status. So if you now are one of those people that can't partake in that because of what you have, the allergy, or the immune system that is compromised, then you have to fall back to basics. Simple as that. And the basics we all know as they are.
So talk about the types, who decides who gets the Pfizer one or the,
Well, I don't think anybody decides. It's just availability and pricing is the cost of it. The cheapest one, I think, is more the Russian one, which we don't have here. But then the other ones are like $20 a vial, as you know. And if you imagine you need 16 billion, 16 billion, multiply that by $20, and then multiply that by $10, you can see the difference. I don't have to do the maths for you, you know exactly. So it depends on what's available in the country where you are. It depends on what the GDP is whatever, what percentage of the GDP is actually allocated or assigned to maybe the health side of things, and that's it. And of course, if you live in a country where it's been produced, probably you get more access to it. Like for example, the Pfizer one, you have the Americans, you know, taking charge of that, and the Germans. You know, you have the Oxford one. Clearly, when it comes out, it'll be more available in the UK readily in comparison to the other one. And that's why I'm saying the 3 weeks that we talk about and the 12 weeks is more to do with the fact that this Pfizer one, which is stored at -60, -90, clearly it's a lot more of a logistical problem. Think about it, -60, -90, takes a lot more to store that and to travel with that or take it along. So it becomes a problem. Whereas if you got the one that is stored in fridge temperature, well, of course, you use that. It's maybe $20, but these are all the multifactorial aspects that you have to look at. You look at how you can use it. In 5 days, you should have got rid of one whole batch of the Pfizer one, whereas with the Oxford one, the Moderna, clearly you don't have that. You can carry it as a GP or as a doctor, carry it and vaccinate people in their homes. Easy. No
I'm going to
problem.
bring it, Doc. I'm going to bring in Marta, and then we've got Vanessa, and then we will round up.
Okay.
So, Marta, can you unmute yourself and ask your question? Marta McCain? Right. Whilst we waiting, maybe I'll bring in Vanessa then.
Hi, Dr. Kamara. Just wanted to ask, is there any information available for people to make an informed choice about which vaccine they choose? And if you could guide anyone to any site?
I mean, the vaccines are there. If you go onto the WHO site, the vaccines are there. I mean, the one I've given you,
Okay.
I think the slide that shows that was the one that I got from the University of Leicester. They're there. Now, which ones are available would be a difficult one because it depends on where you live. It depends on the country you live in. If you live in a country where the Moderna one is more available, that's probably what they'll propose to you. If you have the one that is Pfizer, probably that's the one they'll propose to you. So it all depends. But as I say, it's not mandatory. It's a matter of choice. If you prefer to go wait for the Moderna one, it's beginning to roll out. I think they started rolling it out by the end of this week. Last week, they started rolling it out. So you should get there. You know, you just pray that you protect yourself as best you can so that when you get it, you can actually go onto the GP and say, this is the one that I prefer. And the GP cannot say no, but they'll tell you maybe availability might be a bit challenging and all that. However, it should come. And if it does, then we'll obviously have you on the list. That is not a problem.
Yeah, it's just that we understand that there's a lot of time constraints in GP surgeries and appointments. So if somebody is well read before they attend the GP appointment, then they could make a more informed choice. So it's
Yes,
just.
I agree with that. And that is why we do these talks. That is why I've actually, highlighted what it is that you look for in the 4 vaccines that we know that are, available. I'm not sure about the other 2, the Sputnik one and the other one, but the Moderna and the Pfizer ones definitely are available in the UK.
Right,
But,
thank you.
Yeah.
We've sent an invitation for next week's session to the Minister for Vaccine Deployment.
Super.
And a couple of people, within the NHS. So we're hoping we can get a bit more about that, as well as, people being signposted to a single site that will talk about the ingredients used for the various ones. But, Dr. Kamara, thanks for your presentation and, answering some of the concerns in terms of the ingredients. So I think, Marta, you are on mute now.
Yes, I'm sorry, I couldn't unmute myself before. Thank you very much. Basically, I have an allergic reaction to penicillin. I heard you mention it before, and I know you talked about allergies, but I want to know specifically about penicillin.
Well, thank you for that. I mean, as I say, when you say allergy, allergy is like I can give you a whole lecture on allergies. Mm-hmm. But the allergy that we worry about is the anaphylactic shock or anaphylactic reaction, anaphylaxis, whereby somebody gets an injection or maybe a tablet of penicillin, within minutes to an hour, this person's face swells, the tongue swells, the lips swell.
I've had that. I've had that before. That's happened to me.
Do you carry an EpiPen?
No.
Right, because that is one big thing. Anybody, in my view, because that's one of my pet projects, you know, I look at the hereditary angioedema. In fact, there's papers that we published in that. A lot of people don't know about this, and it's very prevalent. In fact, 1 in 50,000 people get that kind of thing. So it's my kind of pet project, and I looked into it, and there was a cohort of doctors, about 15 of us, that came together, and we thought because it was so poorly understood, we had to do something about it in order to get people to understand it more. So if you fall into that category, what we decided was anybody who develops anaphylaxis to any drug whatsoever, that person should be reviewed by an immunologist.
Right.
That is for sure. And that person would then be assessed, investigated, and clearly that person should be carrying an EpiPen. It's a pen that you can inject through the trousers, through the jeans when you get the attack, because it's a lifesaver.
So how do you get that? How do you get to be seen?
Well, the GP should have been assessing you. If you know that you've developed anaphylaxis, a letter should have gone to him, and he should have been referring you to the immunology clinic, whereby they would actually provide you with this EpiPen. The EpiPen is a lifesaver, because when the attacks happen, that is the thing that goes in straight away without any fiffing and faffing about. It just goes into the muscles, even if it's in the leg, goes in straight away. Similar to when somebody gets a hypo, you know, they conk out and you just give them the sugar and they come back. That's it. This one is actually one that would help you straight away. So you need that. And such a person who's got this really fulminant reaction, this really, you know, if you like, unusual reaction to something that's gone into their body, especially penicillin, should not be playing with that kind of thing, should be messing about, should not be messing with that. Pen is a lifesaver, and therefore such a person cannot be subjected to taking this vaccine.
Right. I just need to ask you this. When I had the attack, it was a medicine that was prescribed by the doctor that caused me, and it was quite a few years ago. I've only had it once, many years ago, and recently when I've been to the doctor about a year before COVID, and I've explained whenever I get medicine from the chemist or the doctor, I always check, yes, that it's not penicillin or related penicillin, just penicillin. I was told, oh, well, if it's years ago, it probably doesn't, sometimes it doesn't affect you anymore. Is that right?
I beg to differ. I'm sorry. If anybody, I keep saying, it's a danger to anybody's life. If that windpipe closes, I tell you what, the men that put people to sleep are really, really trying to avoid that nightmare, that scenario. As best.
So I need to get a letter from the doctor. The doctor needs to refer me to an epidemiologist.
Well, no, immunologist.
Immunologist.
Yeah, one thing I can tell you is, if it is the real thing that I'm talking about, the anaphylaxis, it should be written in bold letters in your notes that this person has developed anaphylaxis to penicillin. Therefore, not on anybody's life should that person be exposed to penicillin. It's as simple as that.
Right. Well, I don't know if it is, because every time I have to
in any form, like I say, you should not be receiving, you should not be getting any closer to penicillin than a cup of tea.
Right. And I shouldn't be taking any of the vaccine either.
If you have had anaphylaxis, yes, you should not be.
Right. Well, I need to go to my GP. I know we can't go at the moment, but I can email him and send a request to him and explain what you've said and tell him what you suggested and get advice from him about where I go from here.
But it'd be nice for you to, as I said, I don't know what the details are. Maybe what you're explaining to me is an adverse side effect, is, you know, that's different. But as I say, if you have had anaphylaxis, I repeat myself, anaphylaxis is something nobody messes with. In fact, it's such a danger that when that person gets that thing, they need to be taken into the research, which is the main room of the hospital. And there you have everybody running helter-skelter because the anesthetist would find it difficult to put a tube down that throat. You can't see anything. That's how bad it gets. and it happens within minutes. Therefore, they try to avoid it.
Right.
It is very important. So if that is something that you've developed, definitely penicillin is a no-no.
Right. I don't know exactly what it, I know that I couldn't speak at the time and I was taken to the hospital. And by the time I got to the hospital and I came out, it had worn off.
Right.
But the doctors, whenever I've ever spoken to the doctor about it, he's never shown, I've always tried to talk to him about it and he's never really told me that it's anything more than an allergic reaction. That's all he's ever said.
Well, let me tell you, this is what I'm saying. You talk about allergic reaction, that's a different thing from anaphylaxis. Anaphylaxis is the severest form of the allergic reaction.
Pardon?
Anaphylaxis is the extreme end. You know, you got the spectrum, for example, you got the lower one, the less one, like you got, you know, scratching and things and all that. The extreme, the highest one is this anaphylaxis, where I tell you, like I say, if someone comes to me and says they've taken penicillin, and of course the eyes are swelling, the lips are swelling, and when they're talking to me, they're clearly, I know this person should never, I repeat, never have penicillin again in their lives.
Can you spell that word, please? Pardon?
I think Martha, I'll send you a direct message. I mean, what we can do is, if you drop us an email, info@CAHN,
yeah,
we can link you up. But also, if you live anywhere across Greater Manchester, whatever support you need, you know, with regards to your GP, we can, you know, bring. I mean, we can provide that support.
Okay.
Yeah, for you, and it's great, you know, good timing. We having conversations, and there is approval. There's a whole training program that, you know, based on some of the issues that are coming up from the health, as well as from our Black medical consultants, there will be a training program rolled across GPs, you know, surgeries in relation to Black health and some of the concerns and some of the issues we have, so that, you know, our GPs could engage with, you know, our community a lot better. But also, we know advocacy keeps coming up, and sometimes our people don't know how to express themselves and challenge and demand what they need. So that health literacy bit, we also looking into that, you know.
Brilliant.
But I will email you. We can get, you know, based on what you've shared, get, you know, something written up that
I was going to say, could you could give me some guidance about what to say? Thank you very much. Thank you so much.
You're welcome. But I think, Doc, the final one, you know, is whether people with genetic conditions, you know, can take the vaccine, and which one you advise. I know you might have touched on it, but, you know, someone is asking if people have genetic conditions, should they take the vaccine?
I mean, if you have genetic condition, I don't know how that is a contraindication for you to take it. As I say, this is something to protect you and your immune system. So if you've got a genetic condition where the immune system is weak, is, you know, if you like, compromised, that's the term we use. Obviously, you fall into that category. As I say, I don't have the details, and so asking me to sort of talk something off the cuff without knowing what the details are is a bit of a difficult one. But the GPs, as I say, I'm not here to replace the GPs. I'm not here to replace any of them. I'm just here to help us understand the magnitude of the problem we're facing. You know, try and at least give the advice that is required. Make sure people understand that, look, we stand to gain more, we stand to benefit more if we adhere to the rules of the vaccines than we stand to lose. It's as simple as that. However, the genetic conditions that anyone would have that would actually sort of put you on the opposite side, i.e. become a contraindication for you to receive the vaccine, are very few and far between. And I'm sure the GPs will be able to advise you on that. Just like I answered the other lady earlier on. If the GP has got your medical details, all your history, and so they know exactly what it is you've gone through and whether there are any contraindications to having the vaccines or not. But one thing I know is that the vaccines, usually, if you don't have any immunocompromise and you don't have any severe allergy, you know, then clearly you should be eligible to take it. Simple as that.
Great. Thanks, everyone. It's great to see you all. We've had some real engagement. And Doc, we're going to take final closing words from yourselves. Lots of conversations. And we want to encourage you next week for you to be part of our extended session. You know, perhaps the Minister for Vaccine Deployment could join us. We would also have some from the NHS and Department of Health and Social Care taking questions. But more importantly, we have 13 plus or so, you know, Black doctors that most of you have relationships with, most of you have seen over the last few years. We'll see if Dr. Kamara is available. So it will be a plenary. They're going to make opening statements about why they took the vaccine, why they are encouraging the community to take it. And then they will take lots of questions about the myths, about the ingredients, and, you know, any other concerns you might have. And it's a combination. We've got gynecologists, we have GPs, we have, you know, ENT consultants, you know, emergency medicine doc will be there. There will be cardiologists in there as well. So a wide range of experts, you know, coming to, you know, take questions and your concerns. So Doc, any final closing words?
Yeah, I mean, as I say, thank you for having me. I hope you'd have got something out of this, you know, something positive out of this. But again, I refer you to my take-home message slide. Please, 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 and pretty please, as I said, I'm not here to replace your general practitioners, your primary physicians and all that. If you are unwell, clearly you know what to do. You know, the NHS facilities are free to access at any point in the country. Anywhere in the country is free, you know, and that is one thing we pride ourselves in. But clearly we need to protect the NHS because it's vulnerable like we all are. And therefore, remember, thinking about yourselves, as I said, this is the only time I would ask anybody to be selfish. Look after yourselves. And the only way you do that is by looking at what is good for you. As I say, the loss of life and the suffering is immeasurable. The rise of poverty through the loss of jobs, through the folding of businesses is immeasurable. The mental side effects, mental health effects is absolutely incalculable. The effects that this beast has on our livelihood is yet to unfold. We'll be talking about this in generations to come. But one thing that we can hope for, or I mean, the small glimmer of hope we have is this vaccine. If we ever are hoping to return to a semblance of normality or normalcy, we need this vaccine. And the only way this vaccine can actually achieve what we want it to do is by putting aside the hesitancy and actually coming forward and taking it and receiving it. Remember, we are the most affected, and therefore we need to grab this opportunity by the horns, because without that, we will suffer more than our counterparts. I don't mean to be racist. I don't mean to be whatever it is that you want to tell me, but clearly, as I said, we need to be selfish in this particular regard. We need to look after number one, need to look after ourselves. So please, please, please think about it, weigh the evidence that I've provided and whatever will be provided, and decide your future, not only for yourself, but for your generations to come. Thank you very much for having me, and God bless.
Thanks a lot, Doc. You know, it's been great having you, and you were very detailed with the PowerPoint presentation. So if you can share that with us, that will be really useful. A couple of requests have come through, and usually Dr. Kamara will end his, you know, presentation saying, look after yourself, exercise at least 30 minutes a day, you know, look at your diet. And so therefore, on Tuesdays, we have our Healthy Hearts 1 section. It's between 6 and 7 p.m. It looks at health and as well as physical activity and nutrition and, you know, cooking demonstrations and stuff like that. There will be nutritionists on there, and our physical, you know, activity, you know, person, director, you know, personal assistant, or, you know, personal physical activity instructor will be on there. And then on Wednesday afternoon as well, we have Orlando, who does physical activity. So please, your diet, you know, looking after yourself, following the public health messaging, washing your hands, you know, keeping your space, you know, it's all really important. And as you can see, you know, for next week's session, you know, most of the consultants, you know, coming on they will be telling you why they've taken it. You know, Hilaria was on the call. Her husband, Mr. Theophilus Asumu, has had he's been on the call a couple of times, taking sessions on, orthopedic stuff related, subjects. Hilaria says she's going to have it, if it's offered to her, documented. I think what we need more in our community is to deal with the lack of trust. And so therefore, we like the honesty of, Dr. Kamara this morning. He was saying he's not had it because of the time lag. He's waiting for something that will be effective from day one. So all the consultants we will be bringing are genuine ones. None of them has been bribed. None of them will coerce you. None of them will offer any misinformation. They will share their personal opinions with you. They will ask you to go back to your GPs to verify that, which is really important, so that we can collectively have a healthy community and live longer. And that's what CAHN is all about, eradicating health inequalities for the Caribbean and African community within a generation. Hopefully, next week is on COVID as well. Then there's, the following one will be on, gynecology, and then we'll get into mental health, and then back into, periods. Some of you remember Dr. Patrice Arthur. So there's a whole lineup, and hopefully next week I can introduce, Karen Hodgkinson, who is our new new head of health and well-being, who will be co-facilitating and taking some of these sessions on Saturdays. But be rest assured, Faye Bruce, our chair, will be on the call. Myself, as the chief officer for the organization, will be on the call, and many of my colleagues as well. So between now and then, between now and Tuesday evening, look after yourselves, hands, face, space. Follow the public health messaging, look after yourself and your loved ones. If you have any questions at any time, just drop us an email, info@cahn.org.uk. We have access to, probably 20 plus, consultants and GPs. I think Dr. Joseph Omofuma was on the call this morning as well, but he will be back next week, on the plenary. And, any concerns, we will, share that with our doctors and, come back to you. We also have a helpline, feel free, anything COVID related or non-COVID related. We have a counseling service, is led by Black, trained, accredited counselors. It's all free of charge. So any support we can be to you, feel free. If we can't deliver anything ourselves, we'll always put you in touch with those who can. So Dr. Mohamed Kamara, who is based at Tameside, senior consultant in emergency medicine, we're really grateful for your time. Hopefully, if next week you are available, I know you will be joining us. And as you have a passion for the community, and I think this evening you have a session with the Sierra Leonean community. So anyone interested in that session as well, just drop us an email. We will share the, flyers and the booking, links as well. But it's great to have our community engaging, and, our real ambition is come, 10, 15 years time, our Black community will have the same health outcomes and life chances like the majority population. So look after yourself, and we look forward to seeing you on Tuesday. And then next Saturday, the extended session where we're hoping the Minister for Vaccine Deployment will be with us, and our 13 also consultants. It will be an interesting one. So bye for now.
Thank you.